Hi, this is Dr. Walker. Welcome back to the channel, denwalker.com. Today I'll talk a little about cyanocobalamin, and how it is utilized in your body. So, a lot of people want to take a B12 supplement for lots of reasons, for increasing focus and increasing energy and prevention of sort of peripheral nerve disorders, right? But what I'm going to tell you is kind of surprising here to you. Now, most of us have been taking cyanocobalamin because we assume, or people have assumed, that B12 equals cyanocobalamin. And what I'm telling you now is that cyanocobalamin is a synthetic form of B12. So the reason I'm talking about this again is because I mentioned before that there is a part of that combination of things, cyanocobalamin, that breaks down into cyanide. Now, a lot of people will tell you that the cyanide part of that is not a big deal because it's very little bit, and your liver processes it and gets it out of your system, so it's not a big deal. So then you're left with just the cobalamin part of that. So let's just say that you're disregarding the cyanide part of that, and you're going to just take that cyanocobalamin part. Now, that B12 version, or part of that combination of things, still needs to be activated by your body, right? It still needs to be activated by your body. So that is the inactive form of B12, must still be activated. Now, about half the country have a disorder called methylene tetrahydrofolate reductase gene disorder, or the MTHFR gene disorder, that prevents you from activating that B12. So let's say, again, you're going to disregard the cyanide part of it. You have the B12 part of it now. That still needs to be activated by your system, which means that if you have that MTHFR gene disorder, you are unable to activate that B12. So you've been taking this B12 now for all of your life, right, with the aim of increasing focus and energy and prevention of peripheral nerve disorders and so forth, but it has not been working for you, for half of you, because you have that gene disorder. Half of you, about 44% of you, have that specific gene disorder. Now, cyanocobalamin is the synthetic version of B12, and it's widely sold. It's sold sort of everywhere, in almost everything you buy in terms of energy or energizing sort of things, like energizing drinks and so forth, or fortified foods. All of those things, typically when they do have some version of B12, it is cyanocobalamin, which is, again, the synthetic version. It's the cheap version. It is the unnatural version. It's not the normal. It's not found anywhere in nature. It is a synthetic, man-made version of the B12. Now, there are lots of other versions of B12 that's absorbed just as well or even better than the cyanocobalamin version. Methylcobalamin and adenosylcobalamin, those are two different versions. Both of those, specifically the methylcobalamin, is a natural, God-given form of B12 found in nature, right? It's found in nature. The other one is not. Methylcobalamin is found in nature. Methylcobalamin is already activated, right? So it is going to do the thing that you're taking it with the intent of preventing peripheral nerve disorder and increasing focus and all those things. It is already activated, right? So even if you were to have that MTHFR gene disorder, right, and you're taking the methyl version or the methylcobalamin, you're fine, right? So if you don't have it, you're fine. If you have it, you're fine, because it's already activated. So it's going to do the job that you're intending for it to do. Now, someone must have known that half of the country, specifically 44% of the people, will have a disorder or a problem essentially activating the B12, the cyanocobalamin version, and hence it's not going to do all those things that you've been taking it all these years to prevent peripheral nerve and keep your nerve sort of active and good, right? It's not doing that for you, right? They must have known that somewhere along, but everything you have been eating from the time that you were born, essentially in baby food, baby formulas, in energy drinks, in all the fortified foods you're taking, in your regular B12 stuff, in your multivitamin, all of those things, most of them have that cyanocobalamin. So I've asked folks to go and look in their medicine cabinets and see which version of B12 they have. And some of them will actually just say cobalamin. That is also cyanocobalamin, right? Unless it says methylcobalamin or adenosylcobalamin, it is cyanocobalamin, right? So it's a synthetic version, not the version you want to use. So if you do see that, my suggestion, if I have that in my medicine cabinet, I'm getting rid of it, and I'm finding ones that specifically say methylcobalamin, because that is already active. Now, you can go and get that MTHFR gene test if you want. Costs about $600 if you want, or and again, so that you can actually methylate or activate all of those things in your system. Or you can just take this version, the methylated version already, because it's already activated and actually does the job that you need for it to do. And again, the Cyanocobalamin version is the synthetic version. The Methylcobalamin, Adenosylcobalamin are both natural, non-man-made version of B12. They work for your system. They work for your body. Now, a lot of folks will tell you, "Oh my gosh, it's just a little bit of cyanide, and it's not going to do a damage to your system. It's going to get processed by the liver, and it's going to go out of your system." They'll tell you that, right? They'll tell you that, but there are so many things. There are so many things that contain the cyanocobalamin. So many things, or specifically that have cyanide in it. For example, I'll just give you one other one. Your regular salt, your table salt, the salt that you've been using in your food all of your life, right? The regular white table salt, that table salt, right? Often contain this what's called an anti-caking agent, which is ferric cyanide, and it's the same process, right? It gets broken down, and the cyanide part gets thrown off, and your body has to process that out of your system, right? And so many other things, but that's just one other one. And you've been using that table salt all of your life, right? So a little bit of cyanide from that, from your B12 you've been taking, from your baby food you've been taking, your energy drinks you've been taking, your fortified foods you've been taking, all of those have a component of cyanide that breaks down from the other part of it. And it's expecting that none of that cyanide cause you long-term problem, because what they're doing is they're looking at it from a standpoint of just in your cyanocobalamin, or just in your B12, and just in your B12 supplement. And maybe one thing, it probably is okay. But when you take the combination of things that has been fortified foods, that has cyanocobalamin, right? The little bit of cyanide in all of those things over your lifetime, right? Just think about that. How often do you use salt? Since the day you're born, how often do you use salt in your food? Table salt. 3 times a day, 4 times a day, right? All of your life. Your body has to process that little bit of cyanide. Anyway, just think about that. Look for versions of B12 that's methylated or methylcobalamin, and it will do you justice long term. And get rid of the other one. Anything that says cyanocobalamin or just cobalamin by itself, just trust me and get rid of it. Thanks for listening, Dr. Walker.